Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, formerly Lee Regional VNA, providing first-rate, highly personalized, short and long-term care for thousands of people in Berkshire County and the hill towns of Hampden and Hampshire counties, all in the comfort of their own homes. And there's nothing more important than great outcomes and the quality of service provided by Porchlight. And in today's day and age of healthcare reform, one of the ways of doing that is to also have great partnerships. And I'm very happy to welcome to the program two ladies who are part of a partnership, Holly Chaffee, who is the CEO and president of Porchlight VNA and Home Care, and also Mary Beth Rucker of Allied Visiting Nurses Association. So the two of you, welcome to the program. It's great to have you.
Thank you, John.
Thank you, John.
Nice to be here.
Yeah, it is. And by the way, your first appearance on the Porchlight show, Holly, so it's great to have you here for this presentation and many more great shows to go indeed. So this is a concept, I think, more than ever that's important when we have healthcare reform, where outcomes are becoming more and more important for a variety of reasons, and having best practices across different VNAs is really critical stuff. So this was an idea, Mary Beth, that you had. You're the founder of this Allied network. So tell me how you came to this decision to start something like this.
Well, I had interfaced quite a bit with VNAs across the state. We all belong to different trade organizations and we all touch base. But after the Affordable Care Act and some of the new initiatives like accountable care organizations, bundling, different methods of rendering care, I thought it would be good for community health organizations, VNAs, to get together and provide a network where we could standardize care, we could share and develop high-level best practices, and we could work together on any other initiatives that came up. You know, I think Tip O'Neill once said all politics is local. Well, all home care is local. It's better to put together initiatives of freestanding nonprofit VNAs together to be able to provide the depth of service in our organizations instead of being one great big visiting nurse association or home care that provides across the state, across counties, across different regions. My perspective, and most of the colleagues that I work with's perspective, is that you really can't provide the level of care if you're sending your cardiac nurse or your wound care nurse to, 100 miles 3 times a day, whereas we can provide that level of care in our single communities. But if we band together as a group and we put together a high level of care, then we can provide it across the state, but still be able to provide our own local home cares.
You know, you raise a great point, because often in healthcare we hear about things like systems and, large companies and so forth, and companies get bigger and so forth. But in the end, it's about people who are taking care of your loved one. And of course, Porchlight has had that reputation of 100 years or so in southern Berkshire County and throughout Berkshire County and beyond now, Holly. So, tell me about how this network and Allied VNAs helps in this overall, because what it's all about is about the care that the patient receives.
That's right, John. And one of the reasons why we agreed to be part of the partnership was that we have patients that patronize other hospitals other than the ones in Berkshire County. So it was important for us to collect those referrals and not lose out on those. And so part of the partnership is there's a central referral system. And those referrals would be called into the partnership and then sent out to whatever area the patients are from. So if there's a Boston hospital that has a patient and we have a relationship with them as the partnership, then we would receive those referrals and be able to help those clients. And the comfort of it is for the patient and for the facilities is to know that we have best practices. We all have the same best practices, we all have the same goals in mind, and we all have the same mission and vision as nonprofits. So it's been a very good partnership.
And for people who are watching this and who may be living in the area that Porchlight serves, not all those people go to Berkshire Medical Center. Not all those people just go to Fairview Hospital. There are different specialists that people would go to see at Bay State Medical, the hospitals in Boston, that sort of thing. So to be able to have those people still understand that they have access to Porchlight care thereafter, that's a big part of what we're talking about here, I would assume.
Absolutely, and it's important that we've band together. We cover all of Massachusetts except for the Cape and the city of Boston. So if someone goes to a hospital in Boston, they can either ask for Porchlight or they can ask for allied visiting nurses, and we will get connected through that network. So
and having it all about quality, Mary Beth, is sort of the ultimate. So in having this, how do people join up, or how have these different VNAs become a part of it? You have a criteria for it. It sounds like they must be nonprofits and have that mission. So that's the number one criteria, I suppose.
I think putting it together to Porchlight to complement them is we looked for somebody in the middle part of the state and the western part of the state that had great outcomes, that we knew manifested very high quality of care. And I knew Hawley, I looked up their data, I looked up their outcomes, and they did have a very high level of quality outcomes. And as an agency and an organization, their dedication is to quality. So that was one of the criteria. There are 12 of us, and it doesn't include all the VNAs or all the nonprofits in the state. It includes the people that met the criteria, which is nonprofit status, which is being able to provide the level of care 24 hours a day, 7 days a week that we require, and being able to have systems that allow them to for us to all network together so we can provide a standardized level of care. It doesn't mean that Mrs. Jones goes to Porchlight. She's going to get a personalized level of care from Porchlight, but the standard is going to be high through the allied VNAs, and that's what Porchlight brings to our network.
So a high quality network, and it sounds like because of that you sought out Porchlight.
Yes, that's exactly right.
To be a part of it, and we use this term, Holly, quite a bit. We in healthcare we talk about outcomes. It may be worth sort of just telling people, the general public, what that means when we say a good patient outcome, which is the ultimate goal.
Sure. We are part of Home Care Elite, and we're one of the top 100 agencies in the nation. All certified agencies have to measure the quality services that they're delivering. So, for example, rehospitalizations is one of those things, and we're noted to be one of the organizations that has a low rehospitalization rate. Primarily, the reason we have a low rehospitalization rate is because we have a continuum of care from acute to chronic care. We have a home visiting nurse practitioner program. We then have the certified organization, which takes all the insurances, Blue Cross Blue Shield, et cetera, Medicare, Medicaid. And we also then have the continuum of care after that, private pay services where people can hire home health aides, live-ins, live-in caregivers, PCAs, homemakers, companion, and even transportation to go to the hospital. Or if they, for example, had visits that they had to make at Bay State Medical Center and needed someone to take them, our aides would drive them there and escort them into the physician office. So that's part of how we keep those low hospitalization rates.
And that's important because that's one of the key elements that healthcare reform is suggesting strongly, that rehospitalization will hurt the whole ACO structure, its bottom line. And so the whole idea is to make sure that when a patient leaves the hospital, that they don't go back within 30 days. And that's a key thing that healthcare reform dictates.
And one of the things too, John, that is, I feel, very important, you have to select your partners carefully. You don't just partner with anyone. As Mary Beth said, the reason we formed the partnership and the reason she selected Porchlight and the others that are part of our organization is because of good outcomes. And we pride ourselves in that as freestanding, not-for-profit organizations. And, you know, home care is local, as Mary Beth said earlier, and really the bottom line is it's about the patient, and we care about the patient. We care about the patient from the top down.
And all home care is local, and also home care now in VNA services more comprehensive, Mary Beth, perhaps than ever, you know, for a variety of reasons, certainly, but, you know, from rehab to obviously the RN services and a lot of complexity that perhaps wasn't done in the home at one point now is. Is that the case?
Yeah, I think that is the case. I think home care always had the ability, and that's why we have Porchlight and the other 11 VNAs together, because we have not only the ability and the outcomes, but the vision. Because really, certified home care is basically hospital care at home. The patient is in the hospital bed, and they've either had surgery or they've had a medical condition, and 12 hours later they're at home and we're taking care of them. They're not that much better. They're not that much less sick. But we can learn to take care of, we can help people learn how to take care of themselves by teaching them and working with them in their homes. So it is very sophisticated, from wound to IVs, and like Holly says, then you go across the continuum. You can have anything from hospice. Porchlight has the private pay services where people can work to stay in their home instead of being institutionalized or having to go to a nursing home. They can hire private care to help them get through their activities of daily living and enhance their wellness.
Yeah, that's very interesting because I think, you know, in looking at great outcomes that Porchlight has had, one of the key components that's very important to the nursing staff is that education component. And as Mary Beth suggested, the whole goal is to get someone back with the highest quality of life, independent, and that means not only just caring for the individual, Holly, but to be able to teach them to do the things that they need to do to stay independent.
Yes, and we have I can't even tell you enough about the staff that we have and the skill set they have for teaching patients. All of our care plans consist of a teach-back method so that they're reviewing the medications with the patient, making sure they understand why they're taking them, having them, you know, check if they know what the side effects are of those medications, and they really do a good job. The physical therapists, the occupational therapists, the nurses, all of them do a very good job of teaching.
And the seasoned staff that you have. And I think there is a difference between, for instance, rehabilitation in a facility atmosphere and what Porchlight provides. It's important to recognize that there's a difference in perhaps the therapists, because there are physical and occupational therapists in addition to nurses.
Yes. They do a very good job of making sure that those outcomes come out the way they need to, and that they work with the patient at whatever level. So every care plan is individualized. And if it takes a patient longer to get to where they need to go, then that's what they do. They would have to do more visits to accomplish that. Then, you know, we allow them to do that.
Now there are 11 different VNAs. Are you
12.
12.
Yeah,
Okay. Porchlight and 11 others.
Yes.
You know, a dozen throughout Massachusetts. And so, are you still seeking out potential other partners for this? Do you see it staying in Massachusetts or going beyond that, Mary Beth? What would be the future?
I probably see at this point it staying in Massachusetts. I mean, every state has different
Right.
regulations, and it's hard to cross states and standardize certain levels of care. Right now, I think we're okay with the partners we have. We just added a new partner. But again, as Holly said, and as we both have said, we want the highest standards met, and we do feel those 12 do meet that.
And so tell me how, tell me about, first of all, you have another day job aside from being the founder of this. You also lead a VNA in the
Right.
eastern part of the state in Middlesex.
Oh, yeah, in Middlesex and Essex County, I'm the CEO of VNA of Middlesex East, and we have a hospice and a home care. Unlike Holly, we don't have the same demographic, so we don't have a private duty because there are so many independent private duties. Whereas Holly's fulfilling a real strong need that they have out here in Western Mass. So that is my job, and that's what I do day to day. Obviously, Allied is woven in with all that. We meet, every 4 to 6 weeks. We review what we're doing. We review our referrals. We review the standards of care. We talk about different programs. We talk about a business plan. And I think we're pretty fussy about who we want to let in, just because we have worked very, very hard over the last year and a half to get everybody on board. We have some really great members, all of them I'd say, but not everybody was like Porchlight and sort of stepped up right away because of the type of care they rendered.
Not all have a president and CEO like Holly Chaffee.
That's right.
And then the other side of things, you mentioned something very interesting about how what works in your region
Right.
may not work, and it's just different.
Sure.
For
Different demographics.
For different demographics, and I think then it leads to a further argument that this is a really great idea, because having a network of individualized VNAs in different regions, as opposed to the thought of having this large sort of corporation which is trying to perhaps use a cookie cutter approach.
Right.
Which doesn't work
No,
necessarily
it doesn't.
in all markets, so to speak, or in all geographic regions. Holly, as you know, Berkshire County is unique. I don't know exactly how it's always different than other places, but it certainly is different, right?
Well, I think one of the challenges we have with healthcare reform and healthcare in general, because it's changing so rapidly, is that people tend to feel a comfort level in doing what they've always done. Mm-hmm. But my motto is, if you've done what you've always done, you'll be who you always were. And we don't want to be who we always were. We want to be somebody a little bit different. And we want to be able to keep up with the pace of the changes that are happening. So it's challenging. This environment is very challenging to move at a pace. I always say a New York minute, let's move in a New York minute because we have to. But in doing so, making sure that the processes are in place that will make things successful.
Right, and of course, we're here on this program, Porchlight, which is an indication of the major rebranding that was done of the former Lee Regional VNA. So that's part of it, having changes. So tell me why that was done, and what that, how that reflects the goals of what you see for the organization.
Sure. About 7 years ago, Lee VNA added the word regional to their name. And the reason they did that was they recognized that people, organizations, elder services, referral sources, physicians, only thought that Lee VNA serviced South County and primarily Lee. So they added the name regional to Lee. And it still didn't accomplish what they had anticipated. So I had presented to the board that we really needed to do something about our name because it was challenging. And we wanted to have a name that would be able to move with us, to travel with us, to be able to create an image in people's mind that home care is personal. So we wanted people to create a vision in their mind. So if you said the word Porchlight, what do you think of? And for me, I think of my parents' home in New Jersey at the shore where they keep the light on for when I come to visit them, because I usually arrive there in the evening. And then as the brand developed and the name was put out there, we recognized that Dr. Stratton, who was a Lee physician for many years, used to tell his clients, if you want me to stop by to help you out this evening, leave the light on. So it kind of tied in our old and our new, and so that made me feel good, because we always want to preserve the history of our organization. We are 100 years old. Last year was our birthday, and but we also want to move forward. So we wanted a name that would appeal to my children and my children's children. Something that was different and unique, but that was also personal and that made people think of home.
And it's interesting that it's sort of the old being new again and so forth. And I think it actually is interesting because the whole model of home care and clinical services within the home is sort of a throwback to doctors who used to do house calls and so forth. And so perhaps things are shifting more, as we suggested before, Mary Beth, in the sense that more and more complex services are being provided in the home.
Right. And I think it is that. I think we've been around, most of us, for over 100 years. We too celebrated our 100th, I think, 4 years ago or so. But we were a conglomeration of Department of Public Health in small towns, and just people banded together and merged together. But I think the new is that we are able to provide hospital-type care at home. I say to my peers when we all talk is, other than surgery and post-surgery and critical care, there isn't much that we can't do in the home. And people would rather be at home, and if you're local, your employees live where they work, they know the people that they work with, and you can still be high-level, high-tech, and still maintain that personal touch, which is why these VNAs are part of Allied.
Yeah.
One of the things that I think home care agencies were never really recognized is as part of the post-acute care continuum. And that's where we're falling now, in the post-acute care. And so other partnerships that we need to develop and are in the process of developing are with nursing homes. They have rehab beds, and then the people are discharged from the rehab beds to home care. And that's an important piece too, that we need to look at those partners and select them carefully and look at their outcomes and their goals and their mission in caring for patients and making everything all about the patient.
Right, and I think in a way, and of course you've heard a lot from what people think about healthcare reform, but I think the positive element to glean from it is that it is focused on the quality elements. There are a lot of headaches that go along with it, no doubt, but picking those right partners who you can trust to be able to do what needs to be done and to make sure that that patient and that person who eventually is going home is as healthy as possible. If that's one of the results of healthcare reform, then that at least is a good thing. With all those headaches that go along with it too, but that's kind of what we're talking about here, is making sure that having good outcomes is essential for businesses to succeed, healthcare agencies to succeed. Wouldn't you say, Mary Beth?
Yeah, I think people are no longer looking at your process. Oh, we go out, we change the dressing, we do that for 6 or 8 months, and now they're looking to see, okay, what kind of outcome? How is the patient doing after you go out and take care of them? That's what people are looking at, results, results-oriented care, and it's up to us to put the compassion in it, if you will, up to us to put the dollar savings in it as well, but we need to get results, and that's what we're aiming to do with these partnerships.
Indeed. And so as we have a couple minutes left, Holly, how can people learn more about Porchlight VNA and home care?
Well, they can friend us on Facebook and
That's right.
Twitter. And they can also contact us at 413-243-1212, or they can look on our website at www.porchlighthomecare.org.
So there you have it. And then Mary Beth, for the Allied VNA Association, how can people learn more about that?
I think they can learn more by calling 781-224-3399. That's sort of where Allied works out of. And they also, in this area especially, they can call Porchlight, and Porchlight will be happy to, especially patients that go in town or different places. Porchlight would, as a premium member, would be glad to assist them with that.
Oh, fantastic. Well, Mary Beth Rucker, a great pleasure meeting
Thank
you,
you.
the founder and director of Allied VNAs, and Holly Chaffee, of course. It's great to have you on the program for the first time, probably the first of several times, so thank you very much.
Thanks, John.
Thank you, John.
And this has been Porchlight, a presentation of Porchlight VNA and Home Care. Thanks for watching.